Understand the definition of disease as well as the kinds, types, and characteristics of diseases. What are acute or chronic diseases? Also understand the stages of addiction and the distinction between an early stage and late stage. The American Psychiatric Association publishes a guidebook for its members known as the DSM. Know what DSM stands for and know how the DSM classifies substance abuse. Also, know that the American Society of Addiction Medicine updated the AMA's definition of alcoholism in 1990. Know what the various components of that definition are so that you can answer the question of what components are included in the ASAM definition of alcoholism. In Chapter 12, know what alcohol and other drugs can do to the central nervous system and which central nervous system components drugs can affect. Know the four major classes of drugs, which are depressants, stimulants, painkillers, and hallucinogens. Know the characteristic of each one of those major classes of drugs and be able to distinguish between them. Finally, know the effect that the common drugs of abuse, such as alcohol, have on the central nervous system. For example, know that the effect of psilocybin and LSD would have on the central nervous system would include them in which class of drugs. Chapter 13, which starts at page 149, includes a lot of statistical information about illicit drug use and abuse. You will not have to memorize each specific percentage, but you should know the relationship generally between the nature and the types of drug use, including alcohol, and how those relate to emergency department episodes. Specifically, you should know that the most common or highest rate of emergency department episodes in the year 2000 was alcohol in combination with other drugs. You should know that adults over age 45 in metropolitan areas had the highest rate of drug abuse deaths, and you should know that the majority of heroin users are white males over the age of 30. Finally, you should know that the synthetic opiate known as OxyContin has increased, the use of that has increased 68% in 1 year between 1999 and 2000, according to the Drug Abuse Warning Network. Chapter 14, which begins at page 161, discusses the various medical treatments as well as holistic approaches to recovery. You should know the classes and names of the medications used in pharmacotherapy, as well as the general characteristics of those medications. For example, antidepressants are medications initially used for treatment of clinical depression. You should also know the treatment of specific clinical syndromes, such as stimulant withdrawal, and what the symptoms of such a syndrome may be. For example, you should know that the acute toxicity of stimulants may cause which symptoms in the course of the stimulant use. On page 164, there is a list of common prescription abbreviations. Know what those are, know what they mean. Also, know what common prescription medicine does, such as lithium, antabuse, and know what common side effects may be related to those medications. Within the holistic approaches to recovery, starting on page 165, know what the meaning of common terms and types of treatment associated with those holistic approaches. For example, starting on page 168, the manual identifies a number of therapies, starting with acupuncture. And you should know generally what acupuncture is. You should know about chiropractic and the difference between straight chiropractors and mixers. Know about feng shui and where that term comes from. And know about the types of problems that may be helped by hypnotherapy.